Welcome to the X series using the device module. Now that we have reviewed the screen characteristics and buttons on the X series, let's review that the device is ready to be used. Always check the RFU indicator on the front panel first. The RFU indicator has three states: ready for use, flashing, and do not use. If you see flashing or do not use, install a fully charged battery in the unit and check the RFU indicator again. If the RFU indicator continues to display the do not use symbol, remove the unit from service and contact the appropriate technical personnel. Once the device is turned on, a self-test will automatically occur. Be sure to review the battery level, which is displayed on the screen and on the battery itself. Finally, attach therapy electrodes compatible with the X series if they are not already attached. In a patient that is pulseless, it is important to try and maintain chest compressions throughout this process. Make sure that the patient is lying on a hard surface. Place the X series next to the patient. Remove the patient's gown or any clothing from his upper torso. You should place electrodes on clean, dry, intact skin. In the locations where the electrodes will be placed, remove any ointments, remove any transdermal patch, and wipe residual medication off the skin. Dry off wet skin and clip excessive hair. The featured therapeutic electrodes for the adult population when using the X series are the CPR stat pads. These electrodes include a sensor that detects the depth and rate of the chest compressions and chest recoil. When the electrodes are properly positioned on the patient, the sensor lies between the rescuer's hands and the patient's lower sternum. While the rescuer performs chest compressions, the sensor detects the rate, depth, and chest release and sends the information to the defibrillator using Zoll's Real CPR Help and see-through CPR technology. Remove the electrodes from the packaging. Grasp the sternum electrode at the bottom with the attached sensor and peel from the plastic liner. Place the CPR sensor on the sternum, lining up the crosshairs with the patient's nipple line and center of the sternum. Place the sternum electrode in the mid-clavicular line below the patient's right clavicle. If the patient has an implanted pacemaker or cardioverter defibrillator under the right clavicle, angle the electrodes slightly so that the upper electrode is not directly over the implanted device. Gently roll the electrode onto the chest, pushing any air out from beneath the electrode. Grasp the apex electrode at the bottom and peel it from the plastic liner. Apply the electrode so it lines up with the bottom of the pectoral muscle on a male patient, as shown in the diagram. For female patients, place the electrode under the breast. Avoid any contact of the electrode gel with the nipple. If possible, do not place the electrode on skin folds. If the patient is large, place the electrode more laterally. The X series also features Zoll's PD Pads 2 multifunction electrodes. Specially formulated low-viscosity gel provides the best skin coupling, lowers resistance quickly, and virtually eliminates dermal damage. There are additional defibrillation electrodes and cables available for the X series. Consult your supervisor as to the ones in use at your facility. To learn more about these electrodes and other therapy electrodes compatible with the X series, use the Zoll electrode finder located on Zoll.com.